Okay, we are down for the last video. Video submission for week 11. We're gonna do the shoulder. So for number 1, walk through the setup for a shoulder MRI. Setup. So we check the order. We set up the room. We before we go to the room, we dematerialize first. Check our pockets. Check for everything like wallets, keys, cell phones, anything electronic, jewelries, bobby pins, ID badges, and then we're gonna disinfect high touch surfaces, doorknobs, the MRI table, any areas that will be doing the patient care. And then we're gonna place the clean linens, padding. We're gonna ready our proper coil, and then we gotta make sure we provide the patient with the emergency squeeze ball. What coil is used and how is the patient positioned? So for the shoulder, we're gonna use the dedicated shoulder coil, and then positioning would be head first, supine. Where is the laser landmark? Landmark would be the shoulder joint or the glenoid fossa. Describe angulation and coverage for axial, sagittal, and coronal sequences. For the axial sequence planning, we're gonna plan our slices on the coronal plane. We're gonna angle perpendicular to the joint space or the glenohumeral joint on the coronal image, and also perpendicular to the humerus on the sagittal. We're gonna cover from superior to the acromioclavicular joint and into the shaft of the humerus or into the axilla. Also, we have to make sure we put a saturation band over the chest to prevent ghosting artifacts from breathing motion. And then for the coronal sequence planning, we're gonna plan slices on the axial plane. We're gonna angle parallel with the supraspinatus tendon. And then coverage, it should be the whole shoulder joint from the anterior portion of the coracoid process to 2 slices posterior to the humeral head. And then also we're gonna add a saturation band to avoid breathing artifact. And then for the sagittal sequence, we're gonna plan the slices on the axial plane. We're gonna angle perpendicular with the supraspinatus tendon. Our coverage should include the deltoid muscle to 2 slices, medial to the glenoid. And then again, we're gonna add a saturation band to prevent on the chest to prevent ghosting artifact from breathing motion. And lastly, we have the wrist. Again, set up, disinfect, dematerialize first, check for wallets, keys, jewelries, any electronics, cell phones, ID badges, bobby pins. Set up, we disinfect everything, place clean linens and padding on the table. we gotta ready the proper coil and then emergency squeeze ball for communication. Coil for the wrist is gonna be the small dedicated wrist coil, and then positioning is gonna be head first supine, or the Superman position. Landmark would be the carpals. Angulation and coverage for the axial sequence, we're gonna plan the slices on the coronal plane. We're gonna angle parallel with the joint space, and then coverage from, we gotta cover from metacarpals to the radius and ulna. For the coronal sequence planning, we're gonna plan the slices on the axial plane. We're gonna angle parallel to the radius and ulna, and then we're gonna cover from the dorsal to the palmar aspect. And then sagittal, we're gonna plan the slices on the axial plane. We're gonna angle perpendicular to the distal radius and ulna, and then coverage from side to side or skin to skin.